Today, we're breaking down the new era of prescription weight loss medications and what they could mean for your health journey. These innovative drugs are truly changing the game for people struggling with obesity and related health issues. We'll cover how they work, what results you can expect, possible side effects, and who should consider them as an option. Remember, these medications are powerful tools, meant to boost, not replace healthy habits and lifestyle changes. Let's dive in. First up, let's talk about Zepbound, also known as tirzepatide, a medication that's making waves in the world of weight management. It's being hailed as a true breakthrough, and for good reason. What sets Zepbound apart is its unique dual-action approach. It targets not just one but two key gut hormone receptors, GLP-1 and GIP. By activating both, it works on multiple pathways in your body, helping to dramatically reduce appetite, curb cravings, and boost your metabolism all at once. The results from clinical trials have been nothing short of impressive. Participants lost up to 22.5% of their body weight. So, for someone starting at 250 pounds, that's nearly 60 pounds gone. This kind of weight loss is a major leap forward compared to older medications. In fact, these results are approaching what we see with bariatric surgery, but without the need for invasive procedures, long recovery times, or surgical risks. For many, that's a life-changing difference. Of course, like any medication, Zepbound isn't without side effects. The most common issues are gastrointestinal, things like nausea, diarrhea, and constipation. These symptoms are usually mild to moderate and tend to improve as your body adjusts over time. Zepbound is intended for adults with a body mass index or BMI of 30 or higher, which is considered obese. It's also an option for those with a BMI of 27 or above if they have at least one weight-related health condition, such as high blood pressure, type 2 diabetes, or high cholesterol. The medication is given as a simple once-weekly self-injection, which many people find convenient. However, it's not suitable for everyone. People with a personal or family history of certain types of thyroid cancer like medullary thyroid carcinoma should not use Zepbound. That's why your doctor will take a thorough medical history and screen you carefully before prescribing Zepbound to make sure it's a safe and appropriate choice for you. While Zepbound is a game changer for many, it's important to remember that it's not the right fit for everyone. Weight loss journeys are deeply personal, and what works for one person may not work for another. Always have an open conversation with your healthcare provider to weigh the benefits and risks, and to find the best path forward for your unique needs and goals. Next, Wegovy, semaglutide, kicked off the current weight loss revolution. It's a GLP-1 agonist, reducing hunger and increasing fullness. Clinical trials, about 15% average body weight loss, life-changing for many. Side effects are similar to Zepbound, mostly GI, and usually improve with time. Approved for adults and adolescents 12+ with obesity. Same thyroid cancer warning applies. Screening is essential. Wegovy is a weekly injection, offering a powerful, proven option. It's helped millions, but safety comes first. Saxenda, liraglutide, is an earlier GLP-1 agonist but requires daily injections. Weight loss is more modest, 5–10% of body weight. Still, that's enough to improve blood pressure, cholesterol, and blood sugar. Side effects? Mostly GI, managed by slow dose increases. Approved for adults and teens 12–17 with obesity. Carries the same thyroid cancer warning. Screening is a must. Saxenda paved the way for today's more potent options. Contrave is an oral pill combining naltrexone and bupropion. It works on the brain to reduce hunger and food cravings, especially for comfort foods. Expect 5–10% weight loss similar to Saxenda. Side effects are more neurological: nausea, headache, insomnia, dry mouth. Not for those with uncontrolled blood pressure, seizure history, or certain psychiatric risks. Approved for adults with BMI 30+ or 27+ with a health condition. Contrave targets the psychological side of eating. Qsymia is a prescription medication that combines two active ingredients, phentermine, which is a stimulant, and topiramate, an anticonvulsant. This unique combination works in the brain to help suppress appetite, making it easier for people to eat less and feel satisfied with smaller portions. Phentermine helps reduce hunger signals, while topiramate can alter taste and increase feelings of fullness. Together, they create a powerful effect that can support significant weight loss for many individuals struggling with obesity. Many people notice that food becomes less appealing, and cravings for high-calorie snacks or sugary drinks may decrease. This can make it easier to stick to a healthy eating plan and avoid overeating, especially during stressful times or social gatherings. With consistent use and lifestyle changes, weight loss can reach up to 10% of body weight, or even more in some cases. Qsymia is considered one of the most effective oral weight loss medications available, offering hope to those who have struggled with other options. However, like all medications, Qsymia comes with potential side effects. One of the most common is an increased heart rate, which may be noticeable during daily activities or exercise. Other possible side effects include insomnia, anxiety, tingling sensations in the hands or feet, changes in taste, and sometimes brain fog. It's important to note that Qsymia is not safe for pregnant women, and it should be avoided by people with glaucoma, overactive thyroid, or those who have recently used MAOIs. Qsymia is approved for adults with a body mass index, BMI of 30 or higher, which is considered obese, or for those with a BMI of 27 or higher, who also have at least one weight-related health condition, such as high blood pressure, type 2 diabetes, or high cholesterol. Because of its potency and possible risks, careful screening and ongoing monitoring by a healthcare provider are essential to ensure safety and effectiveness throughout treatment. Orlistat, known by the brand names Xenical and Ali, is a medication designed to help with weight loss by blocking the absorption of some of the fat you eat. It works directly in your gut, where it prevents enzymes from breaking down about a quarter to a third of the fat in your food. This undigested fat then passes through your digestive system and is eliminated rather than being stored in your body. Unlike many other weight loss medications, Orlistat doesn't act on your brain or hormones. It doesn't suppress your appetite or change your mood, so you won't feel jittery or wired. Instead, it works only in your digestive tract, making it a unique option for those who want to avoid medications that affect the central nervous system. With consistent use and a commitment to a low-fat diet, most people can expect to lose about 5 to 10% of their starting weight over several months. The results are best when Orlistat is combined with healthy eating habits and regular physical activity. It's not a magic pill, but it can give your efforts a helpful boost. However, because Orlistat blocks fat absorption, it can cause some uncomfortable digestive side effects. These may include oily or fatty stools, increased gas, and sometimes an urgent need to use the bathroom, especially if you eat a high-fat meal. These effects are usually less severe if you stick to a lower-fat diet. Orlistat is available by prescription for people with a BMI of 30 or higher or 27 and above if you have additional health risks like diabetes or high blood pressure. The lower dose version, Ali, can be purchased over the counter if your BMI is 25 or higher. It's important to know that Orlistat isn't suitable for everyone. It should not be used by pregnant women or by anyone with chronic malabsorption problems or certain gallbladder conditions. Always talk to your doctor before starting any new medication. Because Orlistat can reduce the absorption of some important fat-soluble vitamins, like vitamins A, D, E, and K, it's recommended to take a daily multivitamin, ideally at bedtime, to make sure your body gets the nutrients it needs. Orlistat is a non-systemic medication, meaning it doesn't enter your bloodstream, but it does require discipline. You'll need to stick to a low-fat diet, take your medication as directed, and stay mindful of your nutrition for the best results. We've covered the landscape of modern weight loss medications, exploring how they fit into today's health journeys. These are powerful tools, not shortcuts. Lifestyle change is still key, and healthy habits remain the foundation of lasting results. The right choice is personal and should be made with your healthcare provider, who can guide you based on your unique needs. Ask questions, advocate for yourself, and make informed decisions that support your long-term well-being. If you found this helpful, like and subscribe for more evidence-based health content and practical tips. Stay healthy, take care of yourself, and see you next time.